what's up, America? Did you know that giant corporations and private equity firms are buying up shitloads of veterinarian offices nationwide? And then after they buy those said veterinarian offices, they're raising the prices 3, 4, and even 500%?
Corporations and private equity entering the veterinary space absolutely unnecessarily increases the cost of veterinary care to pet parents. And it has nothing to do with the wages paid to employees or the cost of running an animal hospital. How do I know this? Because I pay 3 times more than a corporate or private equity hospital does for my supplies. When I buy a bottle of medication, I pay $208 for that bottle of medication when a corporate hospital pays $77. Yet they charge more than I do. Just watch. This is an estimate for one of my patients who had to go to an emergency hospital on Friday evening. This is a private equity backed hospital. The exam fee is $190. Radiographs are $575. Now, one of the interesting things that I've experienced with private equity hospitals is they do not allow clients to opt out of the radiology review, which inherently makes x-rays more expensive. You'll see the comparison in my estimate. There's an injection. The first injection is for an anti-nausea medication. You'll see that is almost $98. The second injection is for methadone, which they claimed was to sedate the pet for the x-rays. I have taken many, many, many x-rays on this patient without any sedation, but that is their discretion. This is the charge I want to pay close attention to. The administration of subcutaneous fluids is $138 and some change. So our total for an exam, x-ray with radiology interpretation, an anti-nausea injection, sedation, and subcutaneous fluids is $1,000.96. This is the estimate at my animal hospital. An emergency exam is $130. The x-rays are $225 because we do allow clients to opt out of the radiology review, which is approximately $193 and some change, which is still significantly less expensive. When put together, that's $418. So that's still over $100 less expensive than the x-rays at the other hospital. The injection for anti-nausea medication is $68, which that particular medication I pay 3 times more than private equity and corporate hospitals. I don't have methadone, so I couldn't compare directly, but I did put in a butorphanol injection if we were to sedate, just to make it apples to apples. And then the subcutaneous fluids, those are $30 compared to $138. So our total, there's a range. The low end is close to about $490. High end is about $680. There's a drastic difference. Now, some are going to say that's emergency and there's a premium for emergency fees. I understand that. I did emergency medicine for 12 years, and I promise you in those 12 years, my fees were never marked up that much. Not to mention the fact that we take our own emergencies from 8 a.m. to 8 p.m. So if you were to come to my animal hospital between 8 a.m. and 8 p.m., these are the fees. And if you go to the private equity corporate hospital between 8 a.m. and 8 p.m., you're paying $1,096. It is expensive to run an animal hospital, to pay fair wages, and to buy supplies. But that's different than what private equity and corporate hospitals do when they exploit the love between a human and an animal, that bond. Private equity and corporate hospitals will time and time again talk about how much people are willing to spend on their pets and how the pet care industry is booming. The reason they are charging these amounts is because they know they can. Corporate hospitals and private equity hospitals will also say that because they have so much money, they can invest in better care and they can provide advanced therapies. So can teaching hospitals at far less cost to pet parents. How does it help if people can't afford to care for their pet, especially if it's not just the advanced care that's expensive? All care is becoming unattainable for the average person. I will continue to assert that having a pet in your life should not be reserved for the elite or the wealthy. Goal of corporations and private equity, it's not to provide the most outstanding care at the best cost to pet parents. It's to make money for their shareholders and their investors.